The COVID-19 vaccine for 5 to 11-year-old children has been thoroughly tested, following the same approval process any new vaccine would go through. Based on the data from the clinical study in children, as well as our experience with vaccination of millions of adolescents and adults, independent scientific advisory committees of both the FDA and CDC concluded that the benefits of vaccinating 5 to 11-year-olds far outweighs the rare side effects that occur. You know, there is a lot of information out there about COVID-19 vaccine in children, and frankly, also a lot of misinformation. It can definitely be confusing. What is fact and what is myth? And some parents may think, I just can't tell what's best for my child. I'm going to wait and see what happens. But let me suggest another approach. Think about who is most trustworthy in looking out for children's health. And I would say, without any doubt or hesitation, that trustworthy group is the American Academy of Pediatrics, or AAP, the doctors who care for our children. They have the training, scientific knowledge, experience, and compassion that lead to our trusting their guidance on children's health. In a policy statement, they very clearly said, the AAP recommends COVID-19 vaccination for all children and adolescents 5 years of age and older who do not have a contraindication using COVID vaccines authorized for use in their age. After the recommendation in early November that kids 5 to 11 years old get vaccinated, the president of the AAP, Dr. Beer, stated, sharing this life-saving vaccine with our children is a huge step forward and provides us all with more confidence and optimism about the future. Why does the American Academy of Pediatrics make this strong recommendation for vaccination? It's based on the scientific data about the impacts of COVID-19 disease in kids, the clinical study results of vaccinating in children, which found vaccination to be very safe and effective, and our experience where now over 4 million children, 15 million adolescents, and 234 million people of all ages in the United States have been safely vaccinated. The science shows that the benefits of vaccination far outweigh the risks. It is true that some children, within a day or two after vaccination, will experience a sore arm, perhaps have headaches or be more tired than usual, and may develop a fever. But these occur less often than among adults. And while more severe effects may rarely occur, the benefits of vaccination far outweigh the adverse events. So don't let misinformation lead to confusion, and confusion lead to paralysis where you can't decide what to do. Talk with your child's healthcare provider. Ask questions. Share your concerns, and get your doctor's recommendation about what is best for your child. And if that recommendation is to vaccinate, do it today. The virus is in our community, and every day more people become infected, and the threat of new variants is on the horizon. Don't take a chance. Please make a decision to get your child vaccinated today at one of the many sites vaccinating children around Fairfax County.